More than 600 of the most dedicated, dependable, and determined people around are Chesapeake Health Care. This group is an essential part of our community, serving more than 60,000 patients in a year.
I love it here because I have the opportunity and ability to help people.
Every little detail that everybody puts in this office makes a difference with every patient we see.
I am very proud to be a part of this group. Like, honestly, it's so important to the community, so it's important to me. Like, that's what we're here for.
But Chesapeake Health Care wasn't always so big. In fact, it wasn't always Chesapeake Health Care. 30 years ago, this group opened as 3 lower counties, TLC. The mission was simple: provide care for the people in our community who couldn't get it. With a couple dozen employees seeing a couple of thousand patients a year, all in Princess Anne, it was a totally different world.
Like I say, we didn't have 80 people here when I came on board, and now we've got the 600, so 650 now.
Back in 1994, we had a couple of doctors in adult medicine and pediatrics, a whopping 3 dentists, and believe it or not, behavioral health consisted of only a couple providers.
We just didn't have the capabilities at that point to really make the changes that we needed.
It didn't take long for this health center to grow. By 1999, there was an expansion in Princess Anne, and that was just the start. Our presence started showing up in Salisbury, Pocomoke, and Berlin. One of the biggest challenges was changing perceptions. When TLC started, it was a center for the uninsured. We needed to grow beyond that and make sure people knew.
One of the main missions was to change that stigma and to try to get not just people that was uninsured, but also to get the insured in. And we eventually did.
In 2001, we jumped into the world of women's health, contracting with Eastern Shore OBGYN to provide services. A couple years later, the 2 groups teamed up completely,
There we go.
becoming the only providers delivering babies on the lower Eastern Shore.
It was an easy transition because we already had a really great relationship with TLC. We were already taking care of those patients. We just expanded.
Now, we're able to take care of people through absolutely every stage of their lives.
I feel like we are able to take care of the whole community, and it's wonderful to be able to do GYN care and OB care and take care of patients from the beginning of their life to the end.
Another big growth moment? Getting into the pharmacy business when Delmarva Pharmacy joined in 2007. For them, it meant the ability to get away from the day-to-day hassle of running a business and focus on the people.
Basically, the opportunities are greater to help people out with the programs that are in place. So that way you don't necessarily have to, you're not worrying about making ends meet, you're making sure you take care of the patients that come through.
And the growth kept coming with even more of our neighbors coming on board.
It was like the perfect storm almost, because we had so many things that became opportunities for us, and I think we took advantage of them.
But we aren't taking on just any group.
And chin up to the sky.
To be part of this team, they have to be the right practice, with the right providers and the right people.
We have one mission here, and that's to see patients. And as long as we put the patient first, everything else kind of falls in place after that.
As we keep growing, so does the demand for our services.
I think the more that we're able to provide, the more care people want, and the community's better because of that.
While there have been plenty of changes over the last 3 decades,
All filled in.
there have been some real constants. For one, the commitment to care for our neighbors every day.
I think it's an amazing thing because people don't have to go far for their care. They can come in here with just about anything going wrong, and we can direct them in the right place.
Another constant, our support for each other. This is a team working together,
Excellent.
pushing for the best possible outcomes
Feeling better?
every single day.
Here we go.
We can have people come in here with any problem, and we can refer them to someone who could help them.
Sometimes whenever we're working on kids in their mouth, we also need to talk to their pediatrician to know about, what other medical conditions they are. Are they okay, and are they healthy for dental treatment?
This means every member of the team doing their part to help every member of the community.
Or when I meet someone and I see them struggling, trying to ask a question, as soon as I know that
they speak my language, I will actually tap on their shoulder, hey, I can help.
The healthcare landscape is constantly shifting. This means we need to have a vision and a strategic plan that can roll with the punches, always able to adapt and provide the best possible care to our community.
It's important for us to keep evolving as a health center because the needs of the community keep evolving and we need to keep up with those changes.
And it isn't just the organization that's growing. It's the people who work here. What may start as a job can grow into a calling.
That they've allowed me to be able to do a lot of different things and let me learn and grow.
All of this means our community is a whole lot better. We do it by going the extra mile.
And you have to put yourself in their shoes and say, okay, how can I make you feel better? How can I help you to get over this crisis? How can I help you to thrive?
This isn't lost on us. We know that every day we're making a difference, changing lives and helping neighbors.
If your insurance, if you're sliding fee scale, you're still going to get the same care as everybody. I'm going to treat you the same as everybody.
I feel pretty happy every day at the end of the day that I have been helping several people in different aspects of their life.
We've seen our patients and clients grow up in front of us. Now we're treating the children and even grandchildren of those first patients.
You get to know them. We're a part of the community and you get to know all these patients so well throughout your experience here.
The last 30 years have seen Chesapeake Health Care grow into a pillar that supports our community. Just think about what we have to look forward to in the next 3 decades. Where do we grow from here?